guys, my name is Abhishek and welcome back to MBBS Treasure channel. In this video, we are going to describe about different forms of radiation disease. In my previous video about relating this ionizing radiation pathology, I have already discussed what are the different types of radiations and how these radiations or what are the theories of the mechanism of actions in our body for causing a pathological conditions. So now we are going to discuss what are the forms of radiation disease according to the doses given to a patient during diagnosis. Okay. So first of all, there will be different forms of this radiation disease, and this radiation disease has three forms. First is the cerebral form, second is the intestinal form, and third one is the osteocranial form. These different forms of disease are divided according to the radiations that are given to the patients, or how much or what is the unit of the radiations that is given, that we are going to read. And the radiation are measured in certain simplest unit, like everything is measured in some units. So in that manner, the radiations are also measured in gray unit. Gray is the simplest unit, that is otherwise said as 1 joule of energy absorbed by the body per kg of matter. So if 1 joule of energy will be absorbed per kg of matter, then it will be called as 1 gray. Now comes as these forms of radiations are divided according to the radiation dose. So the first form of radiation dose is the cerebral form, and it depends, or it occurs, this type of disease occurs when the dosage is greater than 51 gray. Of course, it is a very high amount of radiations that is given to a body, or by chance in case of accidents, if the persons get injured through these radiations, if the dosage is greater than 51 gray, then we will call it as cerebral form of disease. This cerebral form of disease is the most or the fatal lethal outcomes after the radiations. Here the death is certain, and the death occurs through this disorder of central regulations. The central regulations disorder will take place. There will be appearance of the symptoms, like there will be collapse, the body will tend to, the CNS will not function, that means there will be loss of consciousness, and there will be anuria like conditions. So these are the central regulation disorder, or these are the symptoms that relates to the central regulation disorder, and the death is certain in this case, and the death occurs in first to third day after the radiation given to the patient, or if the by chance or through the accident the person get exposed to the radiation, if it is greater than 51 gray. Then next comes the intestinal forms. Through the word we can know the intestine is an organ that is present in our GIT, so obviously there will be disturbance in our GIT, and it occurs when the radiation dose is between 11 to 50 gray, and it is marked by severe enteritis. There will be inflammations of this. Enteritis means intestine, and the intestine pathology are somehow, it will show the symptoms like bloody diarrhea, there will be dehydrations and heart disorder. Why heart disorder? This is a very good question, because as it is severe enteritis and bloody diarrhea, so there will be loss of electrolytes through our body, and as we know, if a certain electrolyte, that is potassium, its amount will vary in our body, then our heart problems will occur, like there will be changing in pumping ability of our heart. So it depends totally on this potassium ion. If its quantity or amount in our body will decrease, obviously there will be heart disorder will occur. So that is the reason why this heart disorder is related in this intestinal form. And intestinal form occurs when there will be the radiation dose will be between 11 to 50 gray. Okay, next comes the osteocranial form. This is the very specific, and in this case the effect of the radiation is certain, but the death mostly doesn't occur, but the effect persists for a long period of time. Around it persists for 6 months or 5 months. Okay, but this osteocranial forms occurs in certain phases, and this osteocranial forms also has different variety, or it is divided according to this total amount of radiations given. That is, this osteocranial form is divided. Osteocranial form is given as said as between 0.5 to 10 gray. It is again divided to call as acute radiation disease according to the doses like mild, middle, severe and extremely severe condition of this osteocranial form. But this mild is said to be, the doses is said to be in between 1 to 2 gray, and middle is said to be between 2 to 4 gray, severe is said to be 4 to 6 gray and 6 to 10 gray. So this all total lies between this 1 to 10. That is somehow said as 0.5 to 10 gray. Okay, so this osteocranial form exists in 4 phases. So, during any kind of disease occurring to our body, it also has 4 phases, and I have already said that, like in the same fashion, this osteocranial form of radiation disease will occur in the 4 phases. There will be appearance of initial reactions to our bodies to the radiations. Then there will be some latent or hidden period of the same disease. Then there will be peak of the disease, in which there will be the general condition of the vital condition of the body will be getting worse, and finally comes the outcomes, whether this radiation disease will heal or not, or whether the radiation disease will get more worsen. So this osteocranial form occurs in 4 phases. First comes the period of initial reaction. In this period, what happens? The relative leukocytosis will occur and lymphopenia will occur, and it occurs in between 1st to 2 days after the radiation. These are the radiation effects. So relative leukocytosis. What do you mean by leukocytosis? Leukocytosis means increasing in number of leukocytes. And why it is called relative? As you have known, there will be 2 kinds of leukocytosis, like physical leukocytosis and relative leukocytosis. Physical leukocytosis occurs mostly when, for an example, after you do exercise or after something eating. So leukocytosis occurs for the betterment of our body in order to prevent the inflammation or infection. So why it is relative? Because the body is indirectly getting affected, the radiation dose, or it is getting indirectly affected. That is the reason why it is known as relative leukocytosis. And lymphopenia means there will be decreasing in the number of lymphocytes, like B lymphocytes and T lymphocytes. Then comes the latent or hidden. Why it is called hidden period? Because the period is unpredictable. The person with this persisting with this period can never be predicted, but there are some minor changes that are found, like these erythrocytes, blood counts will get decreased. Erythrocytes, leukocytes and thrombocytes, its numbers will gradually decrease, and it occurs in between 10 to 15 days or 4 to 5 weeks. Then comes the peak of the disease. If this is the illusory state, then of course there will be an outcome, or before the outcome there will be a peak of the disease, in which the general condition will get mostly affected. Why the general condition is mostly affected? Because already the blood count, erythrocytes, leukocytes, thrombocytes, or the component of the blood is already decreased, so our immunity will get decreased, and that immunity, decreasing in the immunity, will lead to auto infection, and there will be arising of certain conditions like aspermia and menorrhexia. Aspermia means absence of production of sperm, and menorrhexia means absence of a menstrual cycle. Why these things occur? Previously, as we know, this radiation affects to the cells that are present in the tissue that are completely, or sorry, that are continuously dividing. This radiation affects those cells that are continuously dividing, and where are those cells present? Those cells are present in the hematopoietic organs and germ cells producing organs. Hematopoietic organs like our bone marrow, and germ cells producing organs like testis and ovary. So the organs will get affected. As the organs will get affected, there will be decreasing in this erythrocytes, leukocytes, thrombocytes, hematopoietic organs like bone marrow, and aspermia and menorrhexia, of course. And finally comes the outcome of this osteocranial form. In this outcome, it totally depends on the severity of doses and how much the body has tends to heal, or how much the body is fighting towards the changes during these three phases. So it is inconsistent and it is unpredictable. So these are the four phases that occurs during the osteocranial form of radiation disease. In this video, we discuss this cerebral form, intestinal form, and osteocranial form of radiation disease. Okay, if this video was helpful, please like, share, and subscribe to my channel. And thank you so much for watching my video.